Well, welcome back to Walk with the Doc. This is August 21st, 2019. A great program for you this morning. Well, today we're very happy to have Dr. Christine Roussel from the hospital. She's the head of pharmacy there. She's a PharmD, so she has her doctorate in pharmacology. Okay. She's also board certified in oncology. And she has a lot of experience across the board in pharmacy, and today she has a couple of things she wants to share with you. And you'll find she's a great speaker, so listen very carefully and come on in a little closer together if you will too.
All right, good morning. Thank you guys so much for coming out today. I'm very grateful to be here. As Dr. Comezzo said, I'm a pharmacist, and I love to talk to people about medication safety. So, a couple basic things. I always tell everybody, who has a med list? A list with all their medications on it. Oh, I see it. This side is beating you guys. I just want to let you know this is the winning side. First and foremost, everyone should carry a list of whatever medications they take on it. They should make sure it's the drug and what dose and how much you take. And also you should bring it to every doctor's appointment and keep it handy if you ever have to go to the hospital. It's one of the #1 things that you can do to help prevent medication errors and help enhance safety. Also, what do we do when it's time to get rid of our medications? Does anybody keep old expired medications in case you need them? You're the only one admitting it, but a lot of people do. I will tell you, it's so important to throw out medication that you're not taking. And the reason why is, if you leave it around, you might accidentally take it. Somebody might accidentally take it, and it could lead to confusion. But medicine is expensive, so I could understand why people don't want to throw it out. So I recommend that you do, but if you choose not to, put it somewhere where it's not with all your other medications. That's the safest thing to do. Does anybody know where they could drop off unused medication?
Police station.
Police station. Where else? Hospital. In Doylestown Hospital emergency room is a giant medication take-back box that is available for free to drop off things.
Plus they're having a countywide one coming up in October.
Definitely. Now, certain medications, unfortunately, are things that other people might want to take. Pain medications, medications for anxiety. So if you have these type of medications, you can also get containers like this, which are basically medication lock boxes. I mean, you can put the medication in and then you can have a little security code on them. You can use this for travel and also in your home. Unfortunately, there's a lot of reports of when people are having a party, somebody may go into your medicine cabinet. So I bought a bunch of these for free, and you guys can have one if you would like one. They're going to be available under the tent. All right, I have 2 more topics. So one is very timely. Dr. Comezzo mentioned medical cannabis, medical marijuana. It's getting a lot of attention, and people are interested in using it to help manage symptoms. So things like pain is probably one of the most common things that people are interested in trying it for. And it definitely can have benefits for patients, but I think it's also important that with any medication that people understand side effects associated with it. Marijuana, whether certified by a doctor or taken recreationally, can actually increase your heart rate, and it can put stress on your heart and make it harder for your body to work. So, example, if you smoked before you walked, you'd have more trouble walking when you do that. So it's really important to understand some of those risks. People who have a history of a heart attack, it can actually potentially increase risk of death if people are smoking it. So there's an option to take it by mouth instead, and that's something that people consider, but it's always important to talk to your doctor first, and specifically your cardiologist if you actually have a cardiologist. One other thing is interesting. Has anybody heard of CBD? Okay, you can buy it in all different places, right? Is CBD FDA approved? No. And you can buy it all over, but it's not tested and they don't study it. And because of that, when you buy it, you may be buying a product that doesn't have CBD in it, or a product that actually contains some components of marijuana in it that would make you test positive for a drug test. So I like to tell people about just being cautious with those products. And plus, CBD actually interacts with blood thinners. So people who are taking things like warfarin can actually have increased risk of bleeding when taking CBD products. So certainly there are benefits to those products, but it's always important to talk to your family doctor or your cardiologist first before trying them. Anybody can feel free to ask me more questions about that as we're walking. And then the last thing that I want to mention is, who here is allergic to penicillin? Got one, I got two. Okay, I'm gonna ask you guys. Okay, so that's great, only two. What kind of reaction do you have?
Anaphylaxis.
Anaphylaxis, okay, that's a real reaction, definitely. Hives. Okay, so it's interesting. When was the last time you had a reaction? Was it recently or more than 10 years ago? More than 10 years ago. So it's interesting. You should always talk to your doctor about it. On the back of the page, I have information about penicillin allergies. And people don't realize that penicillins are one of the best antibiotics out there. And when people report a penicillin allergy, they have longer stays in the hospital and potentially increased risk of having worse outcomes. So it is really important to talk to your doctor, because you may be able to handle some other medications like cephalosporins and other things. So that was my little educational summit. So, do you have any questions?
You had mentioned earlier about carrying a list of your medications and everything.
Yes.
A friend of mine has all her medications downloaded on a small USB drive. She carries on her wrist on a chain. That way, she has to go to the hospital or whatever. All they would do is plug it in, and got all her medication, puts it right there.
That's pretty high tech.
We all have smartphones for the most part. I put mine right on my phone.
I think that's a great idea. And one other thing you can do is just take pictures of your bottles. That's helpful as well. That way you don't have to worry about it. But that's awesome.
Something else you can do is, if the medications, put it in the refrigerator. That way when the EMS comes in, they go there and look for what's medication.
You're right. That is one of the first places that they go and look. Just there's little plastic bags with magnets that people usually use.
I was told to miniaturize my list of meds and carry it with me all the time. If you're in an automobile accident, it would be a nice thing to know what you take.
Definitely. I think it's a great place to keep it in your wallet, or keep it in your visor of your car, or in your purse. It really is important. So when somebody would come into the emergency room, there's a pharmacist at Doylestown Hospital or pharmacy technicians that will ask you about what medications you take. They'll try and contact your doctor's office, will try and contact the pharmacy and look in electronic databases, but figuring out the medicine that people are taking at home is almost like figuring out a puzzle to try and make sure we give the right thing and the right dose, because the wrong dose or the wrong medicine could definitely harm you. So that's a huge safety goal for us.
They want to know what else you take other than a prescription.
Mm-hmm.
You know, they want to know if you're taking vitamins or calcium or something else. So that should be on your list too.
That's a great point. I wrote that on the piece of paper, but I neglected to mention that. Over-the-counter medications, vitamins. Also, if you take any injectable products, sometimes maybe somebody goes to an office and gets an injectable once a month, or they inject themselves with a medication at home. That would be really important as well.
Does the hospital still pass out these medical tracker?
They do pass some of them out, and I couldn't find them this morning. I apologize. I brought the boxes, but I will send more, and I will get more of those printed.
Is pharma a general name, or is there a pharmaceutical company called pharma?
Pharma is an abbreviation for the pharmaceutical companies, but some companies are like Purdue Pharma. That happens to be.
The Purdue is the company, and they just put pharma.
Yeah, they use it in their name as an abbreviation.
That is, pharma itself is not a.
No, it's just a term for general pharmaceutical companies.
Something was said about the medical marijuana for animals.
Mm-hmm.
Is that legal, or can it be done?
So, medical marijuana can only be given to a patient by a physician. You have to go to a physician who's taken a special training program, and they can certify you to access it. It's not a prescription. A doctor can't write for it, but they give you the ability to go to a dispensary and buy it. Now, pets can't get certified in Pennsylvania. However, CBD products are sometimes made for pets. But I will tell you, CBD is actually federally illegal, and there's no protections in the state of Pennsylvania for people to be able to buy it as well. It's a shame that they sell it so you can find it everywhere, but the FDA clearly says it's illegal. So things may be changing, but right now the FDA has no standards for testing or showing that it's safe. So
A lot of the meds your dogs take are the same ones we take.
yes. So they do sell CBD products for dogs, which people do give their pets. But again, you can't guarantee what's in it, and safety is everything.
Taking a chance.
Yeah.
In your experience, in terms of the over-the-counter or herbal medications, as the questioner asked before, ones that we really should look out for, taken with other mainstream medicines for drug-drug interactions?
Sure. So St. John's wort actually has a lot of drug interactions, especially if you're taking cholesterol medication. If you have a history of breast cancer, black cohosh is actually not, could have interactions as well, because it can act like estrogen. But also, it really is important to check the bottles that you get. So our federal government does not regulate dietary supplements. So they've done lots of studies and shown that what's in the bottles is often not even the plant's material. So if you ever want to buy a dietary supplement, look for the letters USP, US Pharmacopoeia, and that's a federal standard that people can elect to adhere to. So that would be the only way to really feel comfortable with the products. But St. John's wort is top on the list. And one of the big things that a lot of different herbal products can cause is increased risk of bleeding. So that's something to be careful with, especially if you take medications related to your blood. And if you're taking any type of cancer medications or seizure medications, you shouldn't take any of them without talking to your doctor.
All right.
All right.
Thank you so much.
Thanks. My pleasure.
Great questions, too.